Comparison between a real case pattern and a what-if scenario of a hypothetical BPD patient number 1509, BPT 068, January 20, 2026. Gerald C. EclaireMD Foundation. Category: Psychology and Personality Disorders. Preface. From 2001 to 2009, I self-studied psychology and personality disorders. During this period, I financially supported 250 abandoned children, abused women, and teenage girls through a charitable program staffed by 4 full-time employed psychotherapists. In parallel, I studied more than 300 books and wrote approximately 200 psychology-related research papers. There was no financial gain involved, only personal expense, intellectual curiosity, and a sense of life purpose. My prior paper No.1506 applied the Viscoplastopology VPT framework to psychological resilience. It intentionally avoided formal psychological questionnaires in order to focus on long-term system data, rather than isolated subjective labels. This paper extends the same systems framework into personality adaptation by comparing a real case pattern with a structured what-if scenario involving borderline personality disorder BPD. Introduction. Personality adaptation reflects how a psychological system learns to endure repeated instability, threat, and uncertainty over time, from a first principles perspective. Psychology exhibits nonlinear behavior, time dependence, path dependence, adaptation, and the coexistence of reversible and irreversible change. For many individuals with personality disorders, symptoms do not appear suddenly. They accumulate gradually as the system adapts to survive. Patterns such as emotional volatility, rigidity, withdrawal, and mistrust are not arbitrary traits. They are survival responses formed under prolonged stress. Many personality adaptations do not arise from choice or character flaws. They emerge from early and prolonged exposure to emotional instability, including abandonment, inconsistency, abuse, insecurity, and chronic stress. Often rooted in a lack of love and care during critical developmental periods, these conditions shape the nervous system to favor protection over openness. For such individuals, trusting others can repeatedly lead to hurt and insecurity rather than safety, under unpredictable emotional conditions. The developing system reorganizes itself to remain functional. Highly protective adaptations may later manifest as persistent psychological difficulties across adulthood. This paper treats personality patterns as long-term system responses rather than diagnostic labels. Its purpose is to explain behavior without blame, moral judgment, or reduction to symptom lists. Systems view of chronic psychological stress. Psychological stress behaves like a persistent external load applied to a system over time, and like acute trauma, which produces sudden disruption. Chronic stress gradually reshapes the system's structure. Some changes are elastic and partially reversible. Others become plastic and permanent once sufficient accumulated strain reorganizes the system. In psychological terms, irreversible adaptations may appear as emotional distancing, heightened sensitivity, reduced trust, sudden mood changes, or fluctuating responses. These are not signs of weakness, they are evidence of survival restructuring. I examine personality disorder patterns through a physics-based lens, which deepen my understanding of their behavioral structure rather than surface symptoms. When such patterns persist over long periods, clinical language may classify them as borderline or other personality disorders. From a systems perspective, these outcomes are predictable consequences of prolonged stress exposure rather than random pathology. Children raised without emotional safety often learn that closeness is unsafe. Emotional distance becomes a protective strategy that may persist into adulthood even when external conditions improve. The system remembers past instability. For individuals with personality patterns such as BPD, emotional distance and hypervigilance often stem from fear of abandonment or ruptured closeness. These patterns are defensive rather than willful. They are not irrational or broken. They require understanding, consistent care, and compassion, like everyone else. Importantly, systems remain capable of further reorganization. Stable environments, clear boundaries, and sustained reduction of psychological stress can shift response patterns over time, even if full reversal is impossible. The MT data analysis and results. This study applies the viscoplastic medicine theory VMT energy model to compare to lifetime psychological trajectories of a hypothetical BPD patient across 5 decades. PO to P5. One trajectory represents a real case pattern, while the other represents a structured what-if scenario in which selected early life conditions and support timing were modified without removing stress entirely. Data structure and inputs for both cases. The output strain represents cumulative psychological burden across decades. 3 primary input stressors were modeled: abuse, representing cumulative emotional abandonment, neglect, and instability, especially during childhood and early adulthood. Therapy, representing professional psychological intervention, spouse or caretaker, representing long-term interpersonal emotional support. The same normalization factors and time segmentation were applied to both cases to ensure comparability. Only the timing, continuity, and source of emotional load were altered in the what-if scenario. Total VMT energy comparison. Total cumulative VMT energy over 5 decades was: real case total VMT energy equals 3,911. What-if case total VMT energy equals 3,314. This represents an approximately 15% reduction in total accumulated psychological energy in the what-if case, while this numerical difference appears modest. Its structural implications are significant when examined through strain trajectory and final stage behavior. While a 15% energy reduction 3,911 to 3,314 might seem small in a vacuum, in systems engineering, a 15% reduction in peak stress or total energy level can be the difference between structural integrity and catastrophic failure. VMT energy contribution ratios. More informative than total energy are the relative VMT energy contribution ratios from each input stressor. In the real case, the VMT energy contributions were: abuse equals 75%, therapy equals 12%, SPAS equals 13%. This distribution shows that early and prolonged emotional abuse overwhelmingly dominated the lifetime psychological burden. Later therapy and spousal support were present but structurally insufficient to offset early accumulated damage. In the what-if case, the VMT energy contributions shifted to: abuse equals 53%, therapy equals 16%, caretakers equals 31%. Several structural changes are evident. The relative contribution of abuse decreased substantially, reflecting reduced abandonment intensity and improved continuity of early caregiving. The contribution of therapy increased due to earlier professional intervention beginning at P2 rather than P3. Caretaker support became a major stabilizing factor, more than doubling its contribution compared with spouse-only support in the real case. These shifts demonstrate that while early damage cannot be erased, the balance of lifetime psychological energy can be meaningfully redistributed through earlier and more continuous human support. Furthermore, the hysteresis loops, both BPD real case and what-if case versus 3 inputs graphs show clear loops. In physics, the area inside a hysteresis loop represents energy dissipated as heat or internal damage. In the MT models, these areas represent the lingering psychological burden that the patient carries even after a specific stressful event has passed. Final stage strain behavior. The most clinically meaningful difference appears at the final stage P5. In the real case, ending strain reached approximately 55%. In the what-if case, ending strain dropped to approximately 45%. This 10% absolute reduction reflects a structurally more stable psychological state despite the persistence of irreversible early damage. The system did not return to baseline, but it settled into a less strained configuration. Interpretation and systems-level conclusion. These results confirm several fundamental principles of psychological system behavior. First, early emotional abuse exerts a dominant and plastically irreversible influence on lifetime psychological structure. Once accumulated, this energy cannot be removed by later intervention. Second, earlier therapy, and sustained caregiving do not eliminate damage, but they reduce the rate of further accumulation and alter the final system shape. This effect is captured not only in total energy reduction, but more clearly in the redistribution of VMT energy contributions. Third, personality disorder outcomes should be understood as structural trajectories rather than diagnostic snapshots. The difference between the two cases is not recovery versus failure, but a difference in slope, saturation timing, and final equilibrium. In summary, the VMT analysis demonstrates that BPD is not a fixed identity or moral defect. It is the long-term outcome of cumulative emotional load interacting with timing, continuity, and quality of care. Early support reshapes lifetime geometry even when full reversal is impossible. Conclusion: through this study, I demonstrate that personality disorder patterns, particularly in BPD, are not random, willful, or character-based. They are long-term structural outcomes shaped by cumulative emotional load, timing of stress exposure, and the presence or absence of consistent human support. By constructing both a real case pattern and a what-if scenario, I did not attempt to imagine a perfect or idealized life. Stress was intentionally preserved in both cases. Only timing, continuity, intensity, and caregiving structure were altered. Even with these limited changes, the lifetime viscoplastic energy trajectory shifted meaningfully. The system did not reset. It softened, the slope changed, and saturation was delayed. This reflects how real psychological systems behave. Early emotional abuse dominates lifetime burden. Later therapy and relationships can reduce accumulation speed, but they cannot erase early damage. This is not pessimism. It is realism grounded in systems behavior and lived experience. Most importantly, this analysis moves beyond symptoms. The VMT curves capture fear-driven structure rather than diagnostic labels. Emotional volatility, distancing, and mistrust appear here not as defects, but as survival reorganization under sustained strain. The what-if case reveals something many personality disorder patients intuitively know but cannot articulate. Small differences in early care, safety, and continuity can reshape an entire lifetime trajectory. What was lost was not perfection, it was stability. From this perspective, personality disorders should be understood neither as fate nor as moral failure. They are structural adaptations, with stable environments, clear boundaries, and sustained care. Systems can still reorganize, even when full reversal is impossible. This is how I understand BPD, not as a label, but as a life shaped by timing, load, and human presence. Although I have been trained as a mathematician, physicist, and engineer, the overall patterns observed in these psychological cases are highly similar to the system behaviors I encountered throughout my high-tech engineering and business career. Ethical disclosurial case descriptions in this paper are presented in anonymized and hypothetical form. Any resemblance to real individuals is coincidental. The purpose of this analysis is to examine psychological patterns and system behaviors, not to identify or evaluate any specific person. Disclaimer: write this paper not for fame, but to share what I have learned so others can understand their health, prevent disease, and live longer, healthier lives. This content is provided for educational reference only and does not constitute medical advice. No doctor-patient relationship is created. You may share this summary freely, but it must not be altered, edited, or republished as your own. All intellectual property rights and copyrights for this article and its related materials belong to T. He author, Gerald C. Shu.